Hey,
Good afternoon. My name is Silvia. I'm going to be your student nurse today. Can I get your name and date of birth?
Sean Dawson, 11/14/88.
Perfect. Thank you, Mr. Dawson. I'm just going to check that against your ID bracelet. That's good. Thank you. And do you have any allergies?
Not that I know of.
Good. I'm just going to be doing a head to toe assessment on you. I'm just going to be assessing everything, your skin, your hair, making sure everything's working properly, such as your muscles, your eyes, and your hearing. Okay, and let's go ahead and get started. Uh, Mr. Dawson, I do have a few questions for you. Do you know what year it is?
2020.
Okay, good. And do you know who our president is?
Trump.
Okay, great. And could you tell me where you are and why you're here?
I'm at the clinic.
Okay, and do you know what we're doing today?
I'm just getting assessed, all over.
Okay, perfect. So the patient is oriented times 4, and he does have the ability to communicate. He's answering my questions properly and with no problems. All right, Mr. Dawson, are you in any pain today?
No, not really.
Okay, good. And before we get started, I just wanted to ask if you need to use the restroom.
No, I already did.
Okay, perfect. We're gonna close the curtain for privacy, and I'm gonna go ahead and do some hand hygiene so we can go ahead and get started. All right, Mr. Dawson, we're gonna go ahead and get your physical assessment started. So the first thing I'm going to do is inspect the skin and the hair. I'm going to be inspecting for the size of the head, the shape of the head, symmetry of the skull, his bony structures, making sure that the color of the skin looks good and distribution of hair looks good, and I'm checking for visible lesions. Everything looks good on Mr. Dawson. Next, I'm going to assess the cranial nerve number 7, which is the facial nerve. Mr. Dawson, I'm going to assess your cranial nerve number 7. It's just the nerve that helps you move your facial muscles. First, we're going to start by wrinkling your forehead. Okay, perfect. And could you clench your eyes tightly for me? Okay, good. Could you smile? And lastly, could you just puff your cheeks? Everything looks good. His cranial nerve number 7 looks good. All right. Next, we are going to palpate the skin, including his scalp. I'm just checking for hair distribution, moisture, texture of the skin, temperature, tenderness, and any lesions. All right, I'm going to start by palpating your scalp. Good. Everything looks good. And now we're going to move down and palpate the rest of the skin. Again, just checking for any tender spots. I'm going to palpate the temporal pulse while I'm there. And last, I'm just going to palpate his sinuses, starting with the frontal sinuses. Mr. Dawson, do you feel any tenderness in these areas?
No.
And the maxillary sinuses? Everything looks good. Okay, Mr. Dawson, we're going to go ahead and inspect your eyes. I'm going to inspect the patient's eyes. We're going to inspect the eyebrows, the eyelids, the eyelashes, the conjunctiva, and the sclera. We're going to inspect the sclera for size, shape, symmetry, color, and hair distribution, and to see if there's any lesions. Okay, Mr. Dawson, everything looks good. Hair distribution looks good. Can you close your eyes? The eyelids look good. The skin has no lesions, and the color is normal. Now I'm just going to check your conjunctiva. I'm going to pull down, and everything looks pink, a pale pink, and it looks moist. So his eyes are fine. Next, I'm going to assess cranial nerve number 2, which is the optic nerve. That nerve helps us with near vision. Mr. Dawson, could you please read this on the paper?
Thank you for being here.
Perfect. His optic nerve number 2, or his cranial nerve number 2, which is the optic nerve, works fine. Next, we're going to assess cranial nerve number 3, 4, and 6. Mr. Dawson, I'm going to be checking your vision and how your eyes move. If you could just follow the pen. We're inspecting laterally, and then diagonally up, down, and then diagonally this way, and back down. Everything looks good. Next, I'm just going to assess his pupils. Make sure that they're equal, that they're round, that they're reactive to light, and they accommodate. Mr. Dawson, If you could just look straight ahead for me. His pupils are equal, they're round. Now if you can follow the pen. All right, and as the pen got further away from him, his pupils dilated, and when it was closer, his pupils actually constricted, so they're working fine. All right, I'm going to turn this light on. I need you to just look straight ahead. Good. As the light went into his eye, his pupils constricted as they should and dilated when the light was out of his eyes. The last thing I'm going to do is I'm going to palpate his eyelids and then the lacrimal ducts, make sure there's no tenderness, puffiness, or drainage. All right, Mr. Dawson, I'm just going to go ahead and palpate your eyelids. Do you feel any tenderness?
No.
All right, and then any tenderness here?
No.
Okay, good. Mr. Dawson's eyes are fine. All right, and now we're going to inspect Mr. Dawson's ears. We're going to start by inspecting the external ear and the auditory canal. I'm checking for size, shape, and symmetry. Mr. Dawson, I'm just going to look inside your ear, make sure everything looks good. All right. The size of his ears look fine, and the auditory canal looks fine. The symmetry of his ears is fine. Next, we're going to assess cranial nerve number 8. That is the acoustic nerve. Mr. Dawson, can you just tell me if you can hear my fingers rub?
I can.
Good. The cranial nerve number 8 is fine. Next, I'm going to assess the external ears for alignment and position. And the position of the ears and the alignment is fine. I'm going to finish this portion by palpating the auricles and the targus of the ear. I'm checking for tenderness, for edema, or any nodules. All right, Mr. Dawson, I'm just going to feel your ears. Is there any tenderness where I'm touching?
No.
All right. There's no edema, there's no tenderness, and there's no nodules in the skin. All feels fine. All right, and now I'm going to be inspecting Mr. Dawson's nose. I'm going to inspect the external and internal nasal structure for size, for shape, symmetry, color, for any lesions, discharge, and any foreign bodies. All right, Mr. Dawson, I'm just gonna go ahead and check your nose. All right, and while I'm here, I'm gonna assess his nares for patency. Make sure there's nothing obstructing his breathing airways. Make sure that the nostrils are open. And lastly, I'm going to check Mr. Dawson's septum for alignment and tenderness. All right, Mr. Dawson, I'm just gonna touch. You tell me if there's any tenderness. No tenderness? Good.
You want to redo it?
Right, and now I'm going to inspect Mr. Dawson's mouth and oropharynx. First, I'm going to inspect the back of his throat, make sure that everything looks fine back there. I'm also going to inspect his mouth, make sure that the size is fine, the shape and symmetry. I'm checking that the moisture is there and that the color is normal. I'm checking for hygiene, for lesions, and any odors. All right, Mr. Dawson, could you please open your mouth? Okay. Okay, there's no odors, everything looks fine. It looks like he takes care of his teeth. Do you have dentures? All right, so there's no dentures and his teeth all look intact. Next, I'm going to inspect the cranial nerve number 10, which is the vagus nerve. I'm gonna have the patient open his mouth, say ah, and the uvula in the back of the throat should drop when he does that. All right, Mr. Dawson, I'm gonna have you open your mouth and say ah. I'm just inspecting your uvula.
Ah.
Perfect. And everything looks fine there. Last, I'm going to assess cranial nerve number 11, which is the hypoglossal nerve. I'm going to have the patient protrude his tongue and move it side to side. All right, Mr. Dawson, last thing I need you to do is open your mouth and stick out your tongue. And now if you can move it from side to side, perfect. It looks like cranial nerve is working fine. And just to make a quick correction, when Mr. Dawson protruded his tongue, I was checking cranial nerve number 12. Now I'm going to be inspecting the neck, which first I'm going to start with inspecting the skin and the position of the neck. When inspecting the skin, I'm just looking for any lesions, masses, anything that looks abnormal. I'm checking the color, any hair distribution from his beard. All right. and everything looks good. His neck looks to be in the correct position. It's not tilted. His head's not tilted in any strange way. I am going to check range of motion next. Mr. Dawson, if I could have you tilt your head to the side and then to the other side. If you could look up and then look down, and everything seems to look really good. All right, we're going to check cranial nerve number 11, which is the spinal nerve. Mr. Dawson, I'm just going to check the strength of your shoulders. If you could just push up against the resistance. Very good. Mr. Dawson's nerve is working well. And I'm going to palpate the trachea. I'm checking for alignment. I'm also checking for the temperature and the texture of the skin while I'm there. All right, Mr. Dawson, I'm just gonna palpate right here, make sure everything's aligned well. While I'm here, I'm gonna go ahead and move up and check lymph nodes. Do you feel any tenderness? And do you feel any tenderness here? All right, everything looks good. I'm going to just palpate the carotid artery one side at a time, and then I'm gonna move on to auscultating it to see if I can hear it. Okay, Mr. Dawson, I'm just checking your pulse. Very good, and I'm going to go ahead and listen to it. I'm warming the I'm warming the diaphragm. Everything sounds good. And last, I'm going to inspect him for jugular vein distension. Mr. Dawson, if you could tilt your head away from me, and I do not see anything abnormal here. I'm going to check the other side. Very good. There's no distension. It looks good. Right, now I'm going to be just checking your upper extremities, your arms. First, I'm just going to inspect your skin. I'm checking for the size of his arms, the shape, the symmetry of both arms, for the color of his skin, hair distribution, lesions, and for cleanliness. And everything looks good. Next, I'm going to be assessing muscle strength and equality. So I'm going to do hand grips, and both of these will happen at the same time so that I can assess equality at the same time. We're going to do hand grips and then arm flexion and extension. All right, Mr. Dawson, can you squeeze my hands? Okay, that feels fine. And now could you pull against me? Good. And now I'm going to have you push. Very good. Next, I'm just going to check his skin. I'm going to palpate and make sure that the temperature of the skin feels good, that the moisture feels fine, checking texture, tenderness, and for any deformities or lesions. All right. Is there any tenderness in your arms while I do this? No. Okay. Next, I'm just going to move down, and I'm going to check his nail beds for capillary refill. And he refills them within 3 seconds, so that's normal. I'm also going to check for deformities and any clubbing. And while I'm here, I'm just going to go ahead and check for skin turgor. That looks good. It went right back down, so there's no resistance in the skin. I'm just going to palpate the brachial and the radial and the ulnar pulses. All right. Okay, and everything feels good. Next, I'm going to inspect Mr. Dawson's interior chest. I'm going to start by inspecting his chest wall, just looking at it and checking for symmetry, for color of the skin, any lesions on the skin. And everything looks fine. There's good symmetry. The color of his skin is fine, and there are no lesions. I'm going to move to assessing his respirations. I'm going to count them for a full minute, and I'm looking for the depth of each respiration. I'm checking the rate, and I'm also looking at the rhythm. After a minute, I can see that his respirations are normal and the depth is normal and the rhythm is also normal. I'm going to be palpating the skin. I'm checking for temperature, moisture, tenderness, masses, and then also hair distribution, and everything looks good. Is there any tenderness, Mr. Dawson? So there's no tenderness, and that is normal. I'm going to move on to auscultate the chest for respirations. I'm going to do this by auscultating from the apex down to the base of the lungs. I'm just listening to his lung sounds. After that, I'm going to move to the lateral chest, and we're just making sure that there are no crackles or any abnormal sounds. Mr. Dawson, I'm going to be auscultating your chest. I'm just going to listen to your lung sounds. If you could take one full breath in and out. At every point, I put the stethoscope. Go ahead and breathe in and out. Again. Thank you. And now I'm going to go just under your arm. Go ahead and breathe in and out. Good. Very good. Good job. All right, and everything sounds good. There's no crackles. There's no abnormal sounds. I'm going to go ahead and listen to his heart sounds. I'm going to start on the right to listen to his aortic. Then I'm going to move over to the left for the pulmonary. I'll move down for Earth's point, for the tricuspid valve, and then also the mitral valve under that. All right, I'm just going to listen to your heart. I'm listening for your rate, for the rate of your heart, for the rhythm, for the intensity, making sure everything's sounding all right. So first thing I'm going to do is I'm going to find his sternal notch. I'm going to move down and find the angle of Lewis. If I move over to the right here, I will find the aortic heart sounds. Over to the left, I will find the pulmonary heart sound. If I move down to the third intercostal space, I should be able to hear Earth's point. To the fourth intercostal space will be the tricuspid valve. And now if I move down to the fifth intercostal space and line it up with the midclavicular line, I'll find the apical pulse. The apical pulse is also, that spot is also known as the point of maximum impulse. It's where the mitral valve is, and if I take a peripheral pulse like his radial pulse, and then later take the apical pulse for 1 full minute, if there's a deficit or a difference between those pulses, that could be a sign of atrial fibrillation. Mr. Dawson's heart sounds all sound fine. And now I'm going to inspect Mr. Dawson's posterior chest. I'm going to start by inspecting, thank you. I'm going to start by inspecting, can you turn some more? I'm going to start by inspecting the posterior chest, and then I'm going to move to the lateral chest. I'm just checking for symmetry, color, making sure there's no lesions. I'm checking for muscle development, for spine alignment, and for posture. So the muscle development looks good. His spine, if you could bend forward, sir. The spine seems well aligned. The positioning seems fine. and his posture looks good. Next, I'm going to palpate skin for temperature, moisture, texture, tenderness, and any deformities that we may find. All right, Mr. Dawson, if you can just tell me if there's any tenderness.
No tenderness.
Okay. All right, and everything looks good. Now I'm going to be palpating his vertebrae down his spine, and then I'm going to palpate around the scapula to make sure that it's that his vertebrae is aligned, and just to check for placement of the scapula. If you can lean forward, Mr. Dawson. All right. And everything feels fine. All right. Thank you. And now to finish up, I'm just going to auscultate the posterior and lateral chest for his lung sounds. I'm having him breathe one full respiratory cycle, one in and out, starting at the apex of the lungs and moving down to the base of the lungs. All right, Mr. Dawson, I'm going to be placing my stethoscope on your skin. If you can breathe every time I place it, one full breath in and out. Good. And I'm not hearing any crackles. I'm not hearing any adventitious sounds. Everything sounds good. I'm going to be inspecting your abdomen, Mr. Dawson. If you could just lean back for me. I'm going to start by inspecting the mid-chest to pubis. So this area, I'm checking for symmetry, color, for scars, lesions, for just the pulsations of the stomach and any bulges. Everything looks normal. I'm going to be listening to his stomach sounds. So I'm going to essentially split the stomach into 4 quadrants and listen to every quadrant for bowel sounds. And everything sounds normal. I can hear gurgling, which is normal. Normally we listen for bowel sounds for 1 minute, and if there are no sounds at all, then that's normally not a good thing. I'm going to move on to palpating. I'm going to palpate all 4 quadrants. I'm checking for bladder tenderness, for any tenderness anywhere in the stomach, and I'm checking for guarding and masses. All right, Mr. Dawson, as I palpate, could you just tell me if you feel any tenderness?
Okay.
Nothing there? And on this side? All right, and I'm not feeling any masses. There's no tenderness, so everything seems fine. Next, I'm going to be, next I would palpate the inguinal region. There, I would be checking for lymph nodes and the femoral pulse. And I'm going to be inspecting the lower extremities, Mr. Dawson. I'm just going to check your legs. First, I'm just going to inspect the legs, ankles, and the feet. I'm checking for the size, the shape, the symmetry of the legs. I'm checking for the color of the skin, the hair distribution, seeing if there's any lesions or if there's any edema. And everything looks fine on Mr. Dawson. There's no edema. And the hair distribution is fine. There's no lesions or masses. Next, I'm going to assess the muscle strength and equality. I'm gonna have him raise his legs with resistance. Okay, Mr. Dawson, if you can raise your leg against my resistance. And this one, and are you able to lift both? All right, everything looks fine. I'm going to be assessing the dorsiflexion and plantar flexion of his feet. Mr. Dawson, can you bring your foot out? And could you bring your foot up and then out? And now let's check this one. Up and now out. Both look good. Now I'm going to palpate the skin. There I'm checking for temperature, the moisture of the skin, the texture, any tenderness, and any deformities. All right, Mr. Dawson, let me know if you feel any tenderness.
I'm good.
Okay. No tenderness?
No.
All right. Now I'm going to be assessing his toenails for capillary refill. Good, and the capillaries refilled within 3 seconds, so that's normal. And last, I'm going to palpate his popliteal pulse, his dorsalis pedis pulse, and his posterior tibial pulses. So first, the popliteal is going to be found behind the knee, and then the dorsalis pedis would be found on the top of the foot. Then we have the posterior tibial, and that would be the same on the other leg. We have the popliteal, we have the dorsalis pedis, and then the posterior tibial. All right, and the last thing I'm going to do is I'm going to assess Mr. Dawson's remaining neurological systems. First, I'm going to ask Mr. Dawson to stand up. Could you stand up, Mr. Dawson? I'm going to be assessing gait. If you could walk there and back for me, and turn around and walk back. All right, his balance looks good. The use of muscles look good. He seems to have good ease of movement and good coordination. I'm going to assess his balance by using the Romberg test. Mr. Dawson, if I could have you stand with your hands at your side. We're going to wait 5 seconds. And now if you can close your eyes, and we're going to wait 5 seconds. There's no swaying. He's standing pretty rigid, so his balance is fine. All right, Mr. Dawson. Next we are going to assess his cerebellar function. With your eyes closed, Mr. Dawson, if I could have you reach for your nose with one index finger, and now alternate with the other. Do it again with the same index finger and the other. And one more time. Perfect. You can open your eyes now. His cerebellar function seems fine. I'm going to, this will conclude the head to toe assessment. Mr. Dawson, do you have any questions for me? No? Okay, well, you have a good day, and thank you for your cooperation. I'm going to end by performing hand hygiene. That's it.